Thank you for having me.
Yes, it's a very pretty dress you have on.
Thank you.
Okay, so first I just want to verify your ID, so your full name and date of birth.
June 2nd, 89.
Okay.
Matt P. ASMR.
Great. And I see we have a 3 p.m. appointment?
Yes.
Okay, great. All right. So, I know that we sent your file over, but I'd just like to know if you're on any medications or supplements right now.
No, I'm not taking any medications.
No medications? Okay, great. Have you ever been treated in the past for anything with the surgeries or?
I did have a C-section with my first child.
With your first child? Okay. How many children do you have?
3.
Okay, great. And what are their ages?
6, 5, and 4.
Awesome. Okay. And were those all C-sections?
No, just the first one was C-section, and the 2 after that were vaginal.
Vaginal, okay. Great. And did you have any complications with birth?
Well, I had a C-section because there was a complication during labor, and I just developed a fever, so a little bit of infection. I was on antibiotics, but nothing major. She was also on antibiotics after coming out, so but we're all good.
All good. Okay. And do you have any known allergies to nuts, latex, any kind of food?
No.
Okay, great. Okay, and what was the age of your first period? Do you remember?
12.
12? Okay. Okay, and then what would you say on a regular basis, how many days between periods?
24 to 28.
Okay.
Yeah.
Would you say that your periods are regular?
Kind of, yes.
Kind of? Do they sometimes?
No, they do come every month, but it's between, like, there's a difference of 4, 5, 6, even a week in between.
Okay, alright, that can be natural. So are you on any form of birth control right now?
No.
No? Okay, great.
He had a vasectomy, so there's no more need for anything like that. Yes.
Very nice. Have you received the Gardasil vaccine?
No, I haven't.
Okay. So are you interested in receiving one today?
No, thank you.
Okay. Is there a reason for that?
I just think it's too late.
It's too late? Okay. Alright. What was the date of your last menstrual period?
About 2 weeks ago.
Okay.
So maybe end of October the 27th.
And how long do your periods last usually?
4 to 5 days.
4 to 5 days. Would you say it's a regular flow or heavy, light?
Irregular.
Okay. Do you experience any spotting in between?
No.
Okay. What was the date of your last pap smear?
About a year ago.
A year ago. Right. Let me just put some of these things out here. Okay. Great. And so where was that pap smear performed?
It was at Northwest Community.
Okay. Yes. Got you there. And what was the date of your last HPV test?
I don't remember having one.
Okay. Would you like me to schedule that for you today?
Sure.
Okay, we can do that after your appointment. It won't take very long. Have you ever had an abnormal pap smear?
No.
Okay. Are you currently sexually active?
Yes.
Okay. So, what was the date of your last mammogram, if you had any?
I've never had one.
Never had one? Okay. So, in about 4 years, you might want to consider scheduling your first one. Right now you're okay, you're a little young, but I will be sure to feel the area when we do the wellness inspection and make sure that you're good to go there.
Okay.
Okay. The date of your last bone density test?
I have never had one.
Never had one, okay. What about a colonoscopy?
I've never had one.
Okay. Any interest in receiving any of those tests today?
No.
Well, you couldn't get a colonoscopy, you would have to fast, but
yeah,
it's not a pleasant experience.
So I've heard.
Yeah. Okay. So, have you had any surgeries in your lifetime?
No.
Okay, no surgeries. Wow. Hospitalized for any reasons other than
just during childbirth? That's
childbirth. Okay, great. I'm going to ask you some questions about your family history.
Mhm.
Just let me know if you've experienced, or any of your family members have experienced the things that I'm about to say.
Okay.
All right. What about ovarian disorders?
No.
Okay. Breast disorders?
No.
Colon disorders?
No.
Diabetes?
No.
High blood pressure?
No.
Heart disease?
No.
Okay. You have great genes.
Yes.
Okay. Do you have siblings?
No.
Okay. Do you drink alcohol?
Sometimes.
Sure. How many drinks would you say per week?
1 to 2.
1 to 2 per week? Well, okay. Do you smoke?
No.
Do you use street drugs?
No.
Okay. Do you use recreational drugs?
No.
Okay. Do you exercise regularly?
I try to squeeze here and there.
Mm-hmm.
Yeah.
Well, I'm sure with 3 kids that you're running around the house a lot, getting a lot of just manual day-to-day exercise. So.
Yeah.
Okay. Do you have a current partner?
Yes.
Okay. And for how long have you been together?
12 years.
Wow. Great. And any other problems at home or anything else, any concerns that you have before we start?
No.
Okay, great. So what I'm going to have you do is just sign this form. This is a consent to care, and if it's okay with you, I'd like to give you a general medical check because it's been a while since I've seen you. That would be blood pressure, heart rate, everything like that. And then go forward with the breast exam and the vaginal exam.
Okay.
Okay, sounds great. Here you go.
Thank you.
Fantastic. Right. Okay, so first I'm going to listen to your heart. If you could just breathe normal for me. Okay, breathe in again. And exhale. Breathe in. Exhale. Breathe in. Exhale. That's great. Now I'm going to listen for any murmurs on the bell side. Breathe in. Good. In and out again. Okay, I see that only S1 and S2 are present, which is very good. If you don't mind, I'm just going to listen to your sides and your lungs. So breathe in and breathe out. Good. Breathe in and breathe out. All right, and on the other side, go ahead, breathe in and breathe out. And breathe in and breathe out. All right, excellent. So that's all normal. Next, I am going to take your temperature. Have you been having any flu-like symptoms in the last week?
No.
Okay. Okay. So, I'm going to take your temperature. You just hold this for a few moments. You could hold that there for me. Great. Okay, now let me see. That's 98.1 Fahrenheit. Next, I'll check your oxygenation. Okay. Alright, that is 94% at room air. Wonderful. Okay. Next, I'll be doing your blood pressure. So, do you have an arm preference?
No.
Okay. Could you hold this for me?
Yes.
Okay. All right. right, now just relax and take a few deep breaths. Alright, great. That is 140/80. So that's normal. Okay, and I'm just going to slide this off. Okay. Right, so all of your stats are normal. Right now I'm going to give you a gown to put on. Okay, so just to protect your body while I do the exam. And let me know if you have any questions figuring this out, because it can be a little complicated.
Okay.
And I'll see you again soon.
Thank you.
In a few minutes.
Thank you.
Okay, put on these gloves. And if you're comfortable, I'm going to go ahead and open your gown and do some palpations.
Okay.
And just feel for any lumps or abnormalities, discoloration.
Okay.
Okay, great. And if at any point you feel uncomfortable doing this exam, just let me know and we can slow things down or talk about it, okay?
Okay.
All right. If you could lift your arm a little bit, just feeling the lymph nodes here. Okay. Okay, press that down and move on to the other breast. Okay. All right, and then we'll go into this armpit too. Very good. Okay, so everything feels normal so far. I'm going to move on to do a vaginal inspection. Okay. And again, let me know if you feel any discomfort here. This might feel a little cold to touch at first. Okay. sample, so again, this might feel cool to the touch, but it's completely normal.
Okay.
We have that. We're going to send this to the lab. Okay, just a few other things. Alright, and then now we're opening the vaginal canal with the speculum. And just hold still, this won't last long. Taking a few samples here. Okay. I'm just going to wipe this down here. Doing great. I'm just cutting off a sample. Okay, do you feel any pain when I press here?
No.
Okay. How about here?
No.
Okay. How about here?
No.
Here?
No.
Okay. Here?
No.
Okay.
Alright, so now I'm going to do some palpations on your abdomen. Let me know if you feel any pain at any point or too much pressure. Alright, great. So that went excellent. I'm going to have you sit up. We'll discuss the results and we'll go from there, okay?
Okay.
Alright, thank you.
Alright, that P. So I did a full exam. Everything felt normal and perfectly healthy. I did take a few samples and we're going to get those results in the next week. We'll call you if anything comes up abnormal, but if you don't receive a call from us in the next week, just assume that everything came out fine.
Okay.
Okay. And so we'll get you scheduled for your mammogram. You're going to go out front to booking, the same place where you pay, and just talk to Lauren and she'll schedule you, okay?
Sounds good. Thank you so much.
Okay, great. Well, it's nice to meet you.
Nice to meet you too.
And I'll see you again.
See you soon.
All right.